Hello everyone, so in this video I am going to cover Frenkel exercises. So I will cover all the Frenkel exercises of lower limb and upper limb, but before that I will cover a brief introduction of Frenkel exercises so that you can understand this concept more easily. So now let's start this topic. So first we will start with history of Frenkel exercises. So Frenkel exercises was developed by Heinrich Frenkel in 1889. So he was treating patients of TAPS dorsalis. TAPS dorsalis is basically a condition in which there is degeneration of sensory nerves. And I guess you all know that sensory nerves carry information to the brain. So when sensory nerves will get degenerate, patients were having symptoms of incoordination, ataxia and loss of proprioception. So Heinrich Frenkel developed Frenkel exercises to treat these patients who were having problems of incoordination. So while treating patients with TAPS dorsalis, Heinrich Frenkel developed Frenkel exercises in which he mentioned if a patient has impaired proprioception or kinesthetic sensation, then we can use other intact sensations. That means if a patient has impaired proprioception or kinesthetic sensation, then we can utilize his other intact sensation like visual sensation or auditory sensation or any tactile sensation like touch, pressure. So we can utilize these intact sensations to retrain those lost sensation, which is proprioception and kinesthetic sensation. So we are using intact sensation to retrain or compensate the loss of sensation, other sensations. So for example, if a person does not have proprioception basically means awareness of joint or awareness of position. Like for example, if I put my elbow joint here and even if I close my eyes, I know that my elbow joint is here. So this is awareness of joint position. So it is proprioception, and kinesthetic sensation means awareness of movement. Like for example, if I am doing elbow flexion, then even if I close my eyes, then I also know that I am doing elbow flexion. But these patients who does not have proprioception or who has impaired kinesthetic sensation, they lack joint position sense or movement awareness sense. So in this we can utilize those sensations which are intact, like auditory sensation or visual sensation, to retrain or compensate proprioception and kinesthetic sensations. So now I will tell you principles of Frenkel exercises. So principles of Frenkel exercises are very important and I want you all to listen it carefully. So basically there are three principles. First is high level of concentration or attention. It means that whatever exercises we are telling patient to do should be in such a position that patient can easily visualize his movements. Like for example, the patient positions should be in such a way that he can easily see whatever movements he is doing. It is extremely important because if he will see his movements, then that movement pattern will get registered in his CNS, in his central nervous system. So attention and concentration, high level of attention towards his movements, whatever movement he is performing, is extremely important because that movement pattern will get registered in his central nervous system. So first principle is high level of concentration or attention. Next principle is precision of movement. So precision means accuracy of movement. So we have to see that whether patient is performing accurate movements or inaccurate movements. So the movement should be accurate because if patient will do accurate movement, then that accurate information will get registered in his central nervous system. And if patient will do inaccurate movements, like for example, normal shoulder flexion is like this, but if patient is performing shoulder flexion like this or like that, then we have to stop the patient and we have to teach normal shoulder flexion. We are not welcoming all those inaccurate movements because if patient will do inaccurate movements, then that inaccurate information will get registered in his CNS and we don't want that. So the movement that patient is performing should be accurate. if he can perform accurately only up to this much range, then that is also fine, but the movement should be accurate. So the last principle is repetitions. So the patient has to keep repeating those movements until he has achieved smooth movement pattern. Like for example, we are teaching shoulder flexion. So if in starting it is possible that he is doing so much of efforts to achieve shoulder flexion, but we have to keep repeating these movements until he has achieved shoulder flexion with ease, with effortlessly, smoothly. So we have to keep repeating those movements until he has achieved a smooth movement pattern. So you have to remember all these three principles while giving Frenkel exercises to any patient. So the first is attention. Patient should give attention towards his movements. Next is accurate movements. Patient should go do accurate movements. And last is repetitions until he has achieved a smooth movement pattern. So now last is techniques. So these techniques I will explain you while I am doing Frenkel exercises. So while I am doing Frenkel exercises, I will keep explaining you all the techniques. So basically there are 4 positions in which we can do Frenkel exercises. First is recumbent position. In this position, our head and our torso remain elevated so that we can easily observe all our movement patterns. Next is sitting and standing and walking. So all these 4 positions we can use to do Frenkel exercises.
So now I will tell you all the Frenkel exercises. The patient should be in comfortable clothing, and first I will tell you exercises in recumbent position. So in this position, head and torso remain elevated so that patient can easily visualize all the movement pattern throughout the treatment session. Before starting any movement, a therapist should give a concise explanation of that movement so that a patient will get a clear mental image of how to perform that movement. First, we will start with hip and knee flexion and extension. It should be done on both sides, right and left leg. In Frenkel exercises, first we teach big joint movements like hip joint, knee joint, and then we will teach small joint movements like ankle joint or foot movements, because these big movements are easy to do, and that's why Frenkel exercises are also known as systematic graduated exercises, because we gradually introduce complex movements. We can also mark 1, 2, 3, 4 as you can see, and we can tell patient to move up to 3 or 4. So according to that we can teach patient. If patient can do only accurately up to 2, then that is also fine, but he should do accurate movements. If patient can perform accurately until 4, then that is also fine. Next is hip abduction and adduction. The speed of the movement can be told by patient through music or through counting or through the movements of the hand, or simply patient can speak. Generally it is said that speed of the movement should be slow, because slow movements require more coordination. Next is alternate hip and knee flexion and extension. Next is both hip and knee flexion and extension bilaterally. Now next is one leg flexion and extension and other leg abduction and adduction. Next is both hip flexion and extension along with abduction and adduction of the same limb. Every exercise should be performed bilaterally. Now teach patient to put heel on a marked point. For example, teach patient to put heel on the patella or the shin of the tibia or at the ankle joint. Therapist can also help the patient to bring the heel on a marked point. As you can see, Therapist can also increase the complexity by bringing his hand up and away from the patient. Now next is heel sliding over the shin of the tibia. So it should be performed until patient can perform it smoothly and effortlessly. So the repetition should be more. Never forget the principles of Frenkel exercises while performing these exercises. Now I will tell you Frenkel exercises in a seated position. So the first is patient has to stretch his heel to a specific marked point, or he can either lift his leg or he can stretch his leg forward. He can do it bilaterally also. Now next is alternate heel stretch on a specific point. First, patient will perform with one leg and then on the other leg. He will stretch his heel on a specific point. Therapist can either tell any point, like for example 2 or 3, and patient has to directly put his heel on that point. Next exercise is changing position from sitting to standing and then standing to sitting. The therapist can also increase the complexity by stopping the patient at any range. Next is forward walking. So for forward walking, you can mark specific points on which patient has to walk, as you can see in this. Next is side walking. Always remember the movement should be accurate. Now next is pivot turning. Now next is weight shifting. Patient will shift weight on one leg and then on the other leg. Next is obstacle walking. Therapist can put any obstacles and patient will avoid these obstacles by turning. Patient can also do catching and throwing a ball to increase coordination. Patient can also do upper limb exercises like the same way we did for the lower limb, like shoulder flexion and extension, elbow flexion and extension, wrist flexion and extension. For shoulder flexion, we can mark points on wall and we can tell patient to perform shoulder flexion. So yeah, this was it, and if you like my video, then don't forget to like, share and subscribe to my YouTube channel Physio's Healing Touch.